Alrighty, so hopefully everyone had a good weekend and we can continue here with our part 2 of medical imaging when we talk about the CT scans and the MRI. All right, now there's a handout that goes with this, so make sure you print it off or take a picture of it or whatever it is so you can kind of follow along. Alrighty, so remember we talked about the planes of the body. So we've got the sagittal plane here that kind of basically cuts you straight down, well, not just straight down the center, but we're going to slice down from top to bottom, from side to side and down. All right, that's the sagittal plane. We've got the coronal plane. So what we're going to be doing here is doing slices across the front. So we're going to be cutting the person from front to back. And then we've got the axial plane. So we're going to be able to cut across the person's body. Right now we're not actually cutting, we're just taking pictures in those planes. Okay, so on your first handout here, we've got a picture of what it looks like from, this is the CAT scan here, and this is the MRI here. So you can see we're looking sideways through the body. So they're not exactly the same person, they're just similar images. And you can see how certain things show up better on an MRI compared to a CAT scan. All right, so this is us looking sideways through the body as if we're looking in one ear and out the other ear. All right, here's our coronal plane. So this is when we're slicing them forwards. This is one that we're a little bit more familiar with. So, and again, you can see the difference in what features show up. Now, the nice thing, again, about both the CAT scans or the CT scans and the MRIs is we can change the view without actually having to change the patient, right? There's that big psoas muscle that's right there. You can see it there, and you can see this one here on this patient here. Here's that aorta flowing through, all right, and breaking off into down into the femoral arteries. You can see the kidney quite clearly here on this guy that can't see the kidney very clearly here. I think it's back here somewhere, but it depends on how deep the cut is as well. All right. So anyway, so you can see the differences between the two MRIs, and we're going to talk about that before we finish this video. And here's the axial plane. So this is the one you're most familiar with. This is one of the ones that they use the most. So this is where we're doing things in slices. All right, so we're going to be slicing from top to bottom in the body. And the other thing is going to come up in another slide is, remember, when we're looking at these axial slices, we're imagining that we're looking up to the person's head. All right, so we're looking from their feet and up. Here's the abdomen. All right, a different kind of a cut as well. This one's a little bit further up, I believe. So we've got our kidneys here in the MRI. Here's your kidneys. Right, we've got some bowels here. You've got some little bowels there as well. You can see the vertebrae here. You can see the vertebrae here. It's a different color. You can see muscle back here. These are the muscles that line the spine to keep you upright. Right here in the center here is going to be your spinal cord, and in the center here is your spinal cord. So again, it's just getting used to looking at these pictures. All right, so here we go. So this is viewed as if we were looking up through the feet. So on your diagram on your handout there, you should have a diagram that kind of looks like this. So it's as if you're lying on your back and we're looking up through the person's feet. All right, so the top part of the picture is anterior, the person's top or front, I should say, and then the back part of the picture here is the posterior. This is the right side, this is the left side. So similarly on your diagram, you might want to label, or you should label, or do label, all right, the anterior. So here's the front, and here's the eyeballs, all right? So we've got to cut through the head here, and here's your two eyeballs. These are all your sinus cavities here, some brain in here. This is part of your brain as well. Okay, there's the back. So this person was laying on their back with their feet up, all right, eyes up. And then we've got the right side of the person and the left side of the person. Okay, so it's pretty, if you just remind yourself that person's laying on, if you remember the picture of most of the people when they're laying on those beds going in those machines, they're, you know, laying on their back, eyes are up, toes are pointed up, and then that'll kind of help you remember. Okay, so now one of the first films, this is on your picture too, one of the first things that comes up on the CAT scan or the MRI is kind of an overview. So the radiologist kind of sees the whole entire overview. That very first picture is the scout film, or also called the scanogram. All right, there's a bunch of information that's on the scanogram. Again, we got the patient's name, we've got the date, you know, the hospital, all that kind of information that's in there as well. Now, this gentleman was born in 1930, but his CAT scan was taken in 2003. So what we're going to see on the scanogram, it kind of tells the radiologist, all right, so this is where all the pictures are coming from. It's coming from the top of his skull down through the base of the skull. And it's showing the radiologist, it's cut in this diagonal direction. So it's not exactly straight, it's being cut. It's an axial cut, but it's being cut on a slant. So the radiologist can see all the slants, all right? Also using the scale along the side, the radiologist gets an idea of how thick those slices are, all right? And then the last thing that they're getting a good idea here is they're seeing how many pictures are taken. So when he goes to look, he's going to know that, or she's going to know, there's like 1, 2, 3, 4. Each of these is a picture all the way down, all right? And you can see down here at the bottom, they're probably not so concerned about whatever is down here. There's probably concern more with what is actually up into the brain. You can see down here the slice gets a little bit thicker because they're probably not looking for anything. All right, so information you should be able to see on a scout film or the scanogram. The very first one is we want to see the scanning plane. All right, so we want to see what angle each of these cuts has been put in. All right, we want to see the extent. So the extent here goes from the top of his skull to the bottom of the skull. So this is how much they're going to take a peek. Well, they're going to look at everything anyway, but the radiologist just kind of wants to know how much are we really going to be looking at here. All right, tells you the number of scans, so we can count through the number of scans that are there. And it also gives you the scale that's here, right? So the person's going to know exactly how thick each of those pieces are. So these pieces can be, you know, millimeter to centimeters thick. Okay. So what we can also do is when we're looking at the scans, we can change the window. So what a window is, it's the way that they set the machine so you can look at certain tissues of interest, all right? So you can say, all right, I want a brain window, and then they, you know, adjust the measurements or adjust the buttons, and then what you get is the image is going to be concentrated on the brain. If you say I want a bone window, it's going to be concentrated on the bone. So the density of the energy that is put out of the machine changes so that you can see each certain type of tissue a little bit easier. Okay, so subtle density differences within the specified range makes the tissue easier to see. And I'll show you a picture about that in a minute. All right, so usually we like a soft tissue window or a lung window or a bone window, and I'll show you the head ones are actually kind of cool. So soft tissue, lung, bone, again, subdural windows. All right, a lung window. Oh, it's a lung window's on there, so they use different types of windows. And again, this is why I was saying the difference between the imaging in an ultrasound and the imaging on a CAT scan is the technologist, once they've set the buttons, the machine does all the work, where an ultrasound technician has to be really, really well trained to get a really good image. All right, of course, the CT or the MRI technologist has to know how to put the correct buttons on. Okay, so if we take a peek here, all right, so here's the MRI CAT scan, or one or the other. This is going to be the CAT scan showing you the brain window, all right? And then you see the subdural window. So in the brain window here, what we're seeing, it's really focusing on the soft brain tissue. You can see a lot of the detail in the brain tissue. This is the same CAT scan all the way along. They've just changed the what the window is. Here's the subdural window. So this is going to show the dura, the lining of the brain. It's going to focus more on that, and then the last one's going to be on the bone, all right? So they can get a good view of the bone window here, all right? Similarly with the MRI, we're going to take a look at the brain. Now there's a little spot there, there's a little tumor there, okay? So we're taking a little peek to take a peek there. Okay, and then here we've got the subdural. Actually, I lied, that's a little brain bleed. And then here you can see underneath the dura, you can see the fluid that's underneath the dura here. And then when we go to the bone window, you can see that there's an actual break in the bone. All right, so we're getting a good idea of exactly where this injury happened and the extent of the injury. Okay, and there, this is kind of funny because you can see the person's eyes there. Alrighty. So the next one here, this is showing you the difference between the two windows. So this is showing you again, this is a CAT scan. So this is showing you when it's focused on, we're looking at the dura in here to figure out what the heck is going on in this person. All right, so we can see that there's a fluid buildup here, and then when we take a peek here with the bone window, we see, here's where the break is. Okay. So the next one is if we want to look at a lung window. So here we have our lung window with the CAT scan, and we have, or the CT scan. We have the lung window with the MRI. CAT scan, you see the bones are nice and white. All right, with the MRI, take a peek here again because it's going to come up to be important. In the MRI, we see the bones look like they're outlined in black Sharpie or black magic marker. All right, so here we can see the density of the tissue as the bronchi spread out. Here we're not seeing that so much. All right, this one here, a soft tissue window, we're seeing the difference between the CAT scan and the MRI here. Okay. So it just gives you a little bit of a different focus. So each of those windows also is going to show the slice thickness on here. So here, when you're reading in the details here, this says, I believe it says 1 millimeter thickness. So when the radiologist is taking a look at this, they know that this is a 1 millimeter slice that they're looking at. Alrighty, so the slices can range from 1 millimeter thick to 10 millimeters thick. So if you're trying to figure out how, like if there's a tumor or something in there, you probably would like to have thin slices so you can actually measure the volume or the extent of the tumor that's in there. So why do doctors use MRIs and why do they use CAT scans? Again, it depends on the injury and what they're trying to look for, all right? And if you only have a CAT scan in your city, you get sent for that anyway. So why would you use an MRI? Now remember with both of them, the great thing about them is you can get different images or different, directions without having to move the patient. So that's a huge benefit, all right? But basically for the MRI, you can change the contrast to highlight different tissue. You can see tendons and ligaments in the major joints a lot clearer than you can in the CAT scan. So even though you can change your types of windows in a CAT scan, an MRI does a much better job at showing a lot of the soft tissue. So things like tendons and ligaments. All right. MRI is best to look for spinal cord examinations. It's better to find brain tumors. And it's also something that's good to use to find multiple sclerosis, or to look at the extent of multiple sclerosis, or sometimes with lower back pain if it's not related to bone issues. Okay. So the other cool thing about an MRI is you can actually use a functional MRI. So this is a little bit different. It's that functional MRI. We're not going to get too much into this, but this is where you can actually see some functional parts of the brain. All right, so you can see where the thinking section is, or the part that moves your hands, or whatever it is. It can actually light up certain parts of the brain. It's really interesting kind of stuff. All right, so here's a little picture of a functional MRI. We've got a brain tumor here. All right, and what they wanted to do is they wanted to see how, like, they just wanted to, they're just trying to figure out what to do with this person. So they had the person move their hand, and this is where hand movement was. So they knew if they took this was a benign tumor. So when they got this out, they just want to make sure that they know exactly where hand movements are. So when they're doing the surgery, they're super, super careful not to touch any of this spot at all so they don't injure any of the hand movement. So that's the functional MRI. All right, and then you'll always hear stories about they put people on MRI and they let them listen to music and certain parts of their brain lit up. So that's what a functional MRI will do. It'll show you what parts of the brain are actually functioning when you're doing a certain activity. Okay, so here we go. Here's the spinal cord that's down here. So you can see that really nice and clear on an MRI. Right, there's the bone again. All right, the bone color is, you can tell it's not a CAT scan because the bone's not bright white. But if you're looking at it, it looks like it's outlined by black Sharpie. All right, these are the discs in between the vertebrae. All right, but CAT scans are better for if you've got cancer. They were looking for cancer, pneumonia, and any abnormal chest x-ray. So a lot of times they'll send you for a CAT scan for chest areas. Okay, they'll send you for a CAT scan if there's bleeding in the MRI, bleeding in the brain, where they'll use an MRI for brain tumors. Viewing inner ear canal. So remember, with your inner ear, you've got the little bones in there, and you've got the cochlea in there. So this is a better way, a CT is a better way to view those. Looking for organ tear. So if you've got a torn liver, something like that, a CAT scan will show you the tear a lot better. Obviously, if you've got broken bones in the spine, so broken bones, basically, they're going to look at most of the time with x-ray, but if you've got broken bones in the spine, or sometimes if you've got weird broken bones that they can't see very well on an x-ray, but they know the bone is broken, they'll send you for a CAT scan. But quite often, they'll send you for broken bones in the spine, like broken bones to see in the spine, because it's so hard to see the vertebrae on an x-ray. All right, again, organs in your chest and your lungs. All right, so here's a CAT scan of the bleeding in the brain, so you can really see this nicely, I guess. If this was not great to have bleeding in the brain, but that would be a nice picture to show you bleeding in the brain. Here is a picture of a CAT scan of a break that shows up a lot better than on a CAT or on an x-ray. So on an x-ray it might be kind of blurry, you know how you get a lot of the overlay as well, but here we're putting all the x-rays onto the spine. Okay, now this one is part of that handout that I gave you on Friday. So it's just interesting how they can do like click, click, click. This T1, T2 just means the different way they change the densities on the MRI machine. So I won't ask you like, oh, what turns up, you know, what color is such and such in a T1, a T2. You don't need to know that. It's just interesting to know. So air and bone cortex. Now this is important because the bone cortex is black no matter what type of MRI you get in a T1 or a T2. It comes up as black, and that's what gives those bones the look that they've been outlined in black magic marker, right? So sometimes and if you remember back too, when we were talking about the bone, the outside layer of the bone has very little water. It's very hard. It doesn't have very much water in it. Remember, with the MRI, what we're doing is we're spinning around those hydrogen molecules that are in, or hydrogen atoms that are in the water molecules. So if we have less water in there, we're going to end up having not as much energy that's released. So it's going to come up as being black. All right. So the bone sometimes can be whitish or grayish or like very dark gray, but that surrounding usually turns up as being black. Fat comes out as being quite white on a MRI. You can see there's difference in the rapidly moving blood and the slower moving blood. Black comes up as being, fast blood comes up to be as black, and then slower blood is gray. The cerebral spinal fluid changes depending on whether you're in a T1 or T2, so it can either be black or it can be white. And then areas with high water content, so if you've got something like a torn meniscus or joint problems where you've got a lot of swelling, the water will come up to be quite white colored. So, and again, if you have an infection, you've got a lot of liquid in there, a lot of inflammation in there, so that's going to come up to be white colored in the T2. All right, so that's going to be one of the things that you're looking for. Alrighty, so here's an example of how, even though it's a dark bone, it still looks like it's being outlined with black marker. All right, so you can still see the outline of the bone. Now look how nice this is too. Hopefully you can see this, but you can really see the outline, like you can really see the muscles in much more detail than you do on the CAT scanner, definitely compared to the x-rays. All right, and then the last slide, this is the torn meniscus. So normally you're going to have this nice little, you know, this little black area in here. All right, it's got some nice fluidy stuff in here, and then there's a torn one, so you see this area here with some extra fluid in there that isn't normally in there. So that's the torn, with kind of what the torn meniscus looks like on the inside. Alrighty, so that's it for today. You have a quiz to do after this, and then make sure you finish up the work that you have to put into the Dropbox, which is about the CAT scan at the hospital. And what I would also like you to do is, remember way back last week I gave you the interpreting medical images worksheet, and it had 4 different views on, and I said just do your very, very best. We'll take it up at some point. So now we've gone through all 4 types of images that are on that sheet. So go back, take a peek at it again, change your answers if you need to, and we're going to take that up tomorrow. All right, so make sure you get it done. And again, if you're wrong, who cares? We'll fix it. All right, so talk to you later.